Kenya is home to over 2 million individuals grappling with epilepsy, a condition that casts its impact on more than 15 million people nationwide. The International Bureau for Epilepsy has reported that a staggering 75% of those affected by epilepsy find themselves in the rural Africa. Despite these challenges, a handful of courageous organizations within Kenya have joined forces to champion a transformative agenda. Their collective mission revolves around placing individuals with epilepsy at the forefront of adoption and execution of global intersectoral action plan targeting epilepsy and other neurological disorders. In a commendable departure from traditional approaches, these organizations are committed to cultivating a human-centric perspective. They recognize the significance of integrating the voices and experiences of those directly affected by epilepsy in shaping policies and interventions. This approach follows a bottom-up strategy that prioritizes sustainable solutions anchored in the principles of inclusion, equality, diversity, and accessibility. By placing the interests of individuals with epilepsy at the core of their initiatives, these organizations aim to create a more comprehensive and responsive framework for addressing the multifaceted challenges posed by epilepsy in Kenya. Through collaboration and a commitment to human-centric values, they aspire to build a society where epilepsy is not only a medical condition, but a nuanced aspect of diverse human experiences.
My name is John Magati, Program Coordinator URISE. URISE is a registered community-owned grassroots organization that places humanity at the core of its mission. Our commitment revolves around creating local solutions for those contending with epilepsy through shifting the power.
My name is Epilepsy Msimbe, the Director of Youth on the Move, Empower Talents with Epilepsy Kenya. Youth on the Move is a brainchild of a Dutch lady called Karin Ossems, founded in 2007. It's a registered NGO under the Non-Governmental Organization Act of Kenya. The mission of this organization is to empower persons with epilepsy and ensure equal participation in society through lobby and awareness creation in partnership with stakeholders. Our vision is an understanding and responsive society that ensures equal participation of persons with epilepsy in developing countries in all aspects of life.
My name is Fred Kiserem, the founder of Kiserem Epilepsy Foundation that is registered under the Societies Act of Kenya, and we are located in Kiambu County. The reason why I started this organization is that I myself am a person living with epilepsy. I was diagnosed while working in Iraq as a pastry chef, and when I came to Kenya, I found out the struggles of people living with epilepsy, and I found out most of them didn't have any access to medication, and also they didn't have any access to good formal education.
My name is Josiah Anderson Kideki, Chairman of Kifafa Care and Support Child Project, based in Homa Bay County, Rachonyo North, Kindu Bay Township. It started in 2008, registered 2008 as an NGO to assist and to facilitate children with epilepsy and disorder around it, and to support even the neighboring counties.
Rooted in World Health Organization and International Bureau for Epilepsy (IGAP), or Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, URISE and its forward-thinking programs align with Government of Kenya's Universal Health Care and Vision 2030. By capitalizing on opportunities such as Facility Improvement Fund, we strategically position ourselves to bring treatment accessibility to the grassroots level through county budget processes, catalyzing transformative changes within our communities.
Youth on the Move is unique in its activities because it focuses on lobby and advocacy, engaging the government and other partners for policies to better the lives of persons with epilepsy. We also engage the community, the caregivers, and the community health promoters. We are known for a unique activity of empowering youth with epilepsy, where we identify them, bring them to our center on a daily basis, take them through the psychosocial support sessions, educate them on accepting their condition, because we realize ignorance is the first step of putting people into stigma, and through that they become the self-ambassadors, going out to these communities, engaging even the people at the clinics, in faith-based organizations, in schools, to create awareness in an effort to stigmatize, to reduce stigma, and ensure equal opportunities for themselves and others out there. Since inception, we have trained over 400 youth with epilepsy. We have reached out to more than 4 million persons through our awareness creation, and we have trained 3,000 community health promoters.
We started these livelihood activities because we found out most of our people living with epilepsy were living with abject poverty. Most of them came from places where they could not go to school, and we found their poverty was recycling itself, and there was lack of food, and therefore we decided to empower these people so that they could go employ themselves or be employed.
Our program includes treatment and management of epilepsy, which we have clinic every month.
I oversee the smooth running of the clinic, and we run the clinic every last Friday of the month. We have over 300 patients from our database, and we are very privileged to get a donation from Raw Foundation.
We have partnered with Baraka Health Center run by German doctors in Mathare, an informal settlement in Nairobi, where we refer people for treatment.
Through an impactful human-centric approach, we've successfully reshaped power dynamics to empower individuals with epilepsy, yielding tangible results.
My name is Stacey Obade. I was diagnosed with epilepsy at the age of 5. In Kenya, sexual and gender-based violence affects us women with epilepsy. Engaging in open dialogue is crucial to addressing the challenges facing women with epilepsy, particularly in the realms of sexual reproductive health, stigma reduction, and other social issues. Advocacy plays a vital role in our community, where our focus is on achieving inclusion, equality, and improved accessibility. Wakenya wenzangu, tupendane, tuonae